Deborah?
Hey, Dr. Jenkins. The first thing I would like you to do for me, if you would, is say it right in that microphone, say it loud, say it proud, that nothing will be done with any of these students without parental consent.
So, we have a wonderful consent process that we partner with the schools. And I actually have copies of that to distribute to you guys, so you guys will see what the consent process looks like. Here you go. Take one and pass it on.
Thank you.
And so at the beginning of the year and at different times in the year, we partner with the school staff to send out to the parents information about the school-based telehealth program and to receive a FERPA and HIPAA compliant consent for them to participate in the program, release of medical information, and also to participate in the medications that could be distributed. And they can agree to or not agree to, based upon their beliefs, any medication that we might administer. At Bessemer, 90% of the parents and guardians have signed a consent form for our students. The consent was designed with the help of compliance officers to follow the student through the elementary school experience, so we don't have to reconsent every year, but it allows us to follow them through all years. We're in the process right now, and that's why our starting date is a little bit delayed at our project at Cone and our project at Washington, because we're in the process of getting those consents in to the point where we can launch the program. If we see a child, or a child is referred to us who does not have a consent on file, we have the ability to call the parent, discuss the consent, and send an e-consent for immediate signature to the parent so that the child can be treated. Or, if the parent so desires, refer the child out to be treated in a face-to-face visit.
And of course, if at the parent's request, that consent can be revoked at any time, like any other doctor's office, correct?
Yeah. So you'll see on the consent, of course, lawyers have written the consent. So there is a clause that you can revoke the consent at any time.
Okay. All right. So just thinking about the walk through the visit, the registered nurse that checks in the patient or the patient, is that nurse boots on the ground, or is that nurse virtual?
So it's not necessarily a registered nurse. Because we have a connection to the physician, we are able to, in real time, and a messaging system through our technology platform, we're able to use CMAs and LPNs in place of registered nurses as an expense saving for this program. But interestingly, at Cone Elementary School, where the system has hired an RN, she has been trained and now certified as a telepresenter. And when we start in a week, she'll actually be our telepresenter, and we'll offer to her something that most school nurses don't have, is backup from a pediatrician.
That is a handy thing. How far do our services with these extend? Like, we do the exam, we potentially prescribe or refer out based on the examination. Do they go ahead and schedule a follow-up visit? And how do we ensure that the patients are able to get these medications?